Hello, everyone. Thank you for joining us this afternoon. My name is Rachel Smythe, and I'm the Education Coordinator here at the Caregiver Resource Center OC. Since 1988, the Caregiver Resource Center has been a trusted partner for Orange County families who are coping with the physical, emotional, and financial responsibilities of caregiving. By providing individualized supportive services, the Caregiver Resource Center stands apart as the only Orange County agency that focuses exclusively on the needs of caregivers who are coping with their loved one's chronic illness. The Caregiver Resource Center provides family consultation, support groups, assessment, and care planning. We offer individual counseling, respite planning, and community education. And here at CRCOC, we host a live stream each month. This month, you've joined us this afternoon for What is the Alzheimer's Association? So I'm joined by Michelle Pichardo, who serves as a Community Engagement Manager for the Alzheimer's Association's Orange County chapter. First and foremost, thank you so much, Michelle, for joining us this afternoon. And I'd like to give you the chance to introduce yourself before we jump in. And if you are watching us this afternoon and you've joined us either on Facebook or on YouTube and you have questions or you'd like to leave comments throughout our presentation, you're welcome to do so. We may not have time to answer questions today, but if it's necessary, we can always provide a follow-up for those of you who've joined us. But with that, I'll turn it over to you, Michelle, to let us know all about the Alzheimer's Association. And again, thank you for being here today.
Thank you so much, Rachel. Hi, everyone. My name is Michelle Pichardo. I am a Community Engagement Manager at the Alzheimer's Association's Orange County chapter. Thank you, Rachel and the CRC team, so much for having us on live today with you. So the Alzheimer's Association is leading the way to achieve a world without Alzheimer's disease and dementia, with a comprehensive approach to helping those who need us the most. We're making an impact both globally and in every community. And with your support, our shared vision will really become a reality. What you see on the screen here today is a copy of our 2024 Alzheimer's disease facts and figures. This is an annual report that the Alzheimer's Association publishes every single spring. On the screen, there are a lot of different facts and figures and statistics that really stand out to us. The two that I like to point out the most often when I'm in community is at the top in green, 1 in 3 older adults dies with Alzheimer's or another form of dementia. And to the right of that, Alzheimer's disease and dementia kill more people than breast cancer and prostate cancer combined. Now, that is incredibly shocking, and I oftentimes get responses from people in community when I'm talking about these statistics. But really, in 2024, we've come a very long way with breast cancer and prostate cancer, both diagnoses and treatments. But Alzheimer's disease and dementia do not currently have a cure. There is no cure for this disease, and that's really why these diseases are killing more people than breast cancer and prostate cancer today. Next slide, please. So our mission statement is the Alzheimer's Association leads the way to end Alzheimer's and all other dementia. We do this by accelerating global research, driving risk reduction and early detection, and maximizing quality care and support. With global research, we are the largest nonprofit funder of Alzheimer's and dementia research in the world. Additionally to that, we host an event called AAIC, which is an international conference. AAIC stands for the Alzheimer's Association's International Conference, and it's a conference that we host every single year. This year we were in Philadelphia. Last year we were in Amsterdam. So we change locations every year. Sometimes it's in the US, sometimes it's abroad. But every year we're bringing together the greatest and brightest minds connected to science in the dementia space to help us share and learn more about this disease and what our latest findings are. With driving risk reduction and early detection, we are encouraging people to have access to early detection, help them find that dignity and be able to make the best decisions about their own care if and when possible. With maximizing quality care and support, I often find myself in community, hosting free education programs and sharing information and resources with people about what the Alzheimer's Association is, what we do, and what services we have available for you to offer. Next slide, please. So this is the question that I get asked the most when I'm in community is what is dementia and what is Alzheimer's disease? So at the Alzheimer's Association, we think of dementia as the dementia umbrella, which you see on the screen. Dementia is an umbrella or general term for the loss of memory and other thinking abilities that are severe enough to interfere with your daily life. So it is 3 o'clock on a Monday. Think of everything that you've done to get to this point in your day today. You probably got out of bed. You might have taken a shower. Maybe you made some eggs for breakfast or picked up a Starbucks somewhere along the way. You did all of those things independently as a healthy individual. Healthy individual meaning somebody who's not currently diagnosed with this disease. When someone is diagnosed with this disease, they will need help doing all those activities that we just mentioned, because as the disease progresses, they will no longer be able to do all those activities on their own. Those are called activities of daily living. Now, back to dementia for a moment. There are many different types of dementias. Alzheimer's disease makes up about 60 to 80% of cases of dementia. It is the most common cause and form of dementia. But below Alzheimer's disease, we have vascular dementia, Lewy body dementia, frontotemporal dementia, Huntington's disease is sometimes considered a type of dementia. And then there is mixed dementia. It is possible to have dementia from more than one cause. Next slide, please. Now, what is Alzheimer's disease? This is the second most common asked question that I get asked in community. Alzheimer's disease is a brain disease that causes problems with our memory, our thinking, and our behavior. The symptoms of Alzheimer's disease eventually grow severe enough to interfere with our daily tasks. Those things I mentioned earlier: bathing, getting dressed, cooking, driving, feeding ourselves. Alzheimer's disease is a progressive disease. The symptoms do gradually worsen over a number of years. In the early stages of this disease, the memory loss is mild, but as the disease journey progresses, people will need care around the clock. The disease is currently ultimately fatal. Next slide. Perfect. So there are some populations that are at higher risk of developing Alzheimer's or other forms of dementia. Black and African Americans are about twice as likely as white Americans to have Alzheimer's disease or another form of dementia. Hispanic Americans and Latinos are 1.5 times more likely to have the disease compared to white Americans. And almost 2/3 of Americans who are currently living with Alzheimer's disease are women. Women are living longer than men. We're outliving our spouses, brothers, male counterparts, and that gives us more time to potentially develop one of these diseases. So let's talk a little bit about the impact of Alzheimer's disease on caregivers. There's two facts that I'll share here with you. And being with the Caregiver Resource Center here today, we know also that caring for someone who's living with Alzheimer's can take a physical, emotional, social, and financial toll on family caregivers. Being a caregiver is the hardest job in the world, and sometimes it does take a village whenever possible. 59% of family caregivers rated the emotional stress of caregiving as high or very high. There's a lot involved, and our life quickly changes as we have to sometimes jump into the role. Sometimes these things happened unplanned as well. So there's a lot to do and manage and navigate as our loved ones progress through this journey. Now, what are the 10 warning signs is the third question that I get asked the most in community. And here they are on the screen. The 10 warning signs are not a checklist. You don't need to experience or show all 10 signs to have concern. I'm constantly encouraging people that if they're noticing 2 or 3 of these, to really pay more attention to their loved one and see how things progress and change. I'll walk you through the 10 signs. Number 1 is memory loss that disrupts with daily life. Number 2 is having challenges in planning or solving problems. Number 3 is difficulty completing familiar tasks. Number 4 is confusion with time or place. 5 is trouble understanding visual images and spatial relationships. 6 is new problems with words and speaking or even in writing. 7 is misplacing things and losing the ability to retrace your steps. 8 is decreased or poor judgment. And 9 is withdrawal from work or social activities, the things you once enjoyed. Number 10 is changes in mood and personality. So if you're finding any of these signs in yourself, in a loved one, in somebody at home, pay more attention, kind of watch, as things progress for them. And again, if you're noticing 2 or 3 of those signs, it might be time to have a conversation and perhaps seek out a doctor. One of the things I mentioned earlier is that the Alzheimer's Association is always encouraging early detection. It's important to pay attention to any changes in your memory, your thinking, or behavior that you might notice in yourself or somebody else. If there are any unusual changes, have a conversation with a doctor, someone you trust at home, or maybe even a friend. And with early detection, there's a lot to be said about having the opportunity to plan for your own future, to explore the various treatment options that are available out there, to maybe participate in clinical studies, or to be able to make your own decisions and have a place in those discussions about your future care, your finances, or any decisions that would happen with you. Now, treatments for Alzheimer's disease, the current medications that are out on the market cannot cure Alzheimer's disease. This disease currently does not have a cure. There are treatment options out there that change the disease progression. And yes, there are some drug and non-drug options as well that can help with some of the underlying symptoms, the memory loss, the confusion, some of the sundowning that may be happening. And those treatments can be administered as a pill, a patch, or even intravenously. But everyone experiences Alzheimer's disease differently. One person with Alzheimer's disease is simply one person with Alzheimer's disease. There is no cookie cutter version of symptoms that are the same from person to person. People's symptoms do indeed vary. It's always important to talk to your doctor to learn more about the various treatment options. And we do have a lot of incredible information available on our website at alz.org/treatments, where you can read more to learn more about the various options that are out there. What science does tell us today about brain health is that there are some risk factors for cognitive decline and dementia. There are some things that we cannot control, like our age. I mentioned that Hispanic Americans and Latinos are more likely to develop Alzheimer's and dementia. I fall into that category. I am Hispanic, and dementia does now run in my family. But there are things that we can control. These are things that we can and should be doing to improve our brain health and our physical health. There's growing evidence that shows that increasing healthy habits can reduce our risk of cognitive decline and possibly dementia. This is true even for people who have a history of dementia in their family as well. It's never too early or too late to start these healthy habits to take better care of your brain and your body. And I want to share a little bit about some of those healthy habits with you today. On the next slide, we'll see 10 healthy habits for your brain and 10 things, again, that we can and should be doing, things that we can control. So staying in school, challenging our mind, moving our bodies, right? We hear about exercise and it feels like it's repetitive, but exercising is truly one of the best things that we can be doing for our bodies. Adding a simple walk to our evening after dinner would make a great difference. Eating right, paying attention to nutrition and what we're putting into our bodies also helps. And with that is maintaining a healthy weight, controlling our blood pressure, managing our diabetes. Protecting our head is incredibly important, and sleeping well also. Most of us don't pay any attention to our sleep. Some of us fall asleep on the couch watching Netflix or Apple TV or Hulu or even the news. But what we should be doing is turning off the TV and heading to our bedroom and going to bed at a good hour. 9, 10 o'clock seems appropriate and fair, but getting to bed and making sure that we're well rested so that we can get a proper amount of sleep. That is something that is completely under our control. Being smoking free as well also helps to keep our brain healthy. But again, These are the things that I want all of you to focus on, because these are things that we can and should be doing to have a healthier life, to try to decrease our risk of developing Alzheimer's or dementia. So, how to make a difference in our community? I want to share some information with you that we'll find on the next slide here about how we can help. So, the Alzheimer's Association is a national nonprofit, and truly, we are the only organization that's working to ensure that everyone in every community has the information, the support, and the resources that they need to navigate every step of the Alzheimer's and dementia journey, from driving risk reduction and early detection to diagnosis to treatment and to quality care and support. I say this today, I've truly been saying it the last 30 days that I've been out in community, that I've attended our support groups myself, or that I've been hosting an education program. We are in the middle of the holiday season, and I want to say that and really highlight our 24/7 helpline, because our 24/7 helpline is truly available 24/7, 365. Our helpline is the 800 number that you see on the screen, 1-800-272-3900. Our staff at the helpline work on alternating shifts through the holiday season to be able to be there to support families across the country and locally with any questions and resources that they may need through the holiday season. Our staff are master's level trained clinicians. You can call them and ask any question related to the disease that you might need help with or have a concern on. If you're at home as a caregiver caring for somebody and your loved one has a behavioral change that you're not sure how to manage, you can call that helpline and ask them questions about what you can and should be doing differently. That helpline number is available to everybody. We have staff available who speak English and Spanish, and then we have a translation service that's good for up to 200 different languages. So again, through the holidays, you never know when someone is going to experience a behavioral change that we're not sure how to manage. Our doctors are not available, unfortunately, 24 hours a day. So as you're navigating this journey and you're not sure where to turn, please remember that that helpline is there and is available for you. We also offer free education programs. Every month, we put out a monthly calendar of programs that are available to the public. We host classes, even in partnership with CRC, classes on topics like understanding Alzheimer's and dementia, the 10 warning signs of Alzheimer's disease, healthy living for your brain and body, effective communication, and dementia-related behaviors, just to name a few. We also offer free support groups for family caregivers. On our website, alz.org/OC, you will find a downloadable PDF with a list of all of the support groups that we have available here in Orange County. We offer those in person and online via Zoom. Not all family caregivers are able to leave their loved ones at home alone, so we've kept Zoom as an option to have those support groups truly available. Next slide, please. And now how you can help us as an organization. So sharing your personal story. You never know when the person standing next to you, maybe even in line at the grocery store, might be caring for somebody who's living with Alzheimer's or dementia. Sharing information with people that you meet. If you go through the holiday season and you are at a family party or work gathering and somebody mentions that they're caring for somebody living with Alzheimer's or dementia, I hope that you remember that we have that 24/7 helpline that's available 24 hours a day. As far as our education programs go, we can host our education programs for companies, groups of people, other organizations. If you're interested in that, please send us an email or reach out, because we'd love to come out and host one of our free programs for you as a free resource. And again, with your community, you can find more information about this disease in our organization at alz.org. And you can find more education, support groups, and caregiving resources at alz.org/community resource finder. Jerome Stone here on the screen is our founder He founded the Alzheimer's Association. His wife, Evelyn, was living with Alzheimer's disease, and he found a need in his community for a caregiver support group. He came together with some volunteers and started our first support group, and that's where our organization really started. His famous quote was, "Do things here and now, not after you're gone. If you have some money, share it, and if you have some time, do something worthwhile. Use your free time to volunteer and make a difference. Help us continue to help other people, especially here in our local community." Our name, yes, says Alzheimer's Association, but our full name is the Alzheimer's Association and Other Related Dementia Disorders. Our vision statement is a world without Alzheimer's and all other dementia. So if your loved one has a diagnosis of vascular dementia or Lewy body dementia, you can still give us a call. You can still call our helpline. We are here to try to end this disease, and our vision statement is to help families and caregivers, everyone really in our local communities, fight off Alzheimer's disease and all other forms and versions of dementia. Thank you for joining me today for today's presentation. And we'll bring Rachel back.
Perfect. That was really, really informative, Michelle. And I did feel like, oh, that's a good reminder for me too. When you said falling asleep on the couch watching Netflix, I definitely have been guilty of that many times myself. And so thank you for all those reminders of things that we can do to help reduce our risk of developing Alzheimer's disease or another related dementia. And then also, I thank you so much for sharing the helpline. That's something that I think every single support group that we do, every single class that we teach, I ask those who are joining us to program that phone number in their phone immediately. I'm like, I'll give you a minute, do it now, because it's so incredibly helpful for families to have that resource. We do have a couple minutes, so if it's okay, I would like to ask you just a couple questions before we close out for the afternoon.
Yeah,
But
definitely.
if you could share kind of one takeaway or one thing that you wish people who have joined us this afternoon took with them about Alzheimer's disease or other types of dementia, what's one thing that you wish that people could take away with them about these diseases?
I think for me, Rachel, I think back to the importance of focusing on our own health. Whether you're a caregiver or not, doing the things that we can and should be doing to reduce our risk of developing one of these diseases is incredibly important. Whether or not dementia or Alzheimer's disease runs in your family, taking care of our health currently as we stand is the only thing that we really can do to better our health in our future. Um, Alzheimer's and dementia changes begin in our brains 10 to 20 years before a diagnosis. So as I see myself right now in my 30s, it's what am I doing for myself to try to reduce my risk, down the line. Sleep is a big one for me, and I've been trying to really focus on getting to bed by 10 p.m. After I set my alarms, I put my phone down on my nightstand and I don't touch it. I turn off the TV, I put on an eye mask, and I really try to, make better changes when it comes to my sleep. Drinking water and staying hydrated, bringing lunch to work. I say this all the time, but I bring an apple to work every day. Truly, every single day I bring an apple to work, and now it's become a joke that I'm the person in the office who slices apples for everyone. Sometimes I'll bring 3 or 4 apples and I'll slice apples for everyone. And I walk around the office sharing sliced apples. And at least for me, if I have an apple with me, I won't reach for a bag of chips. If I bring lunch with me that I cooked from home or that I made from dinner last night, I'm less likely to go across the street to, Jersey Mike's or Carl's Jr. for some lunch. So those are things that I can control, and that's really where it starts.
I really appreciate you sharing all of that too, because I think for those of us who do have this disease running in our family, sometimes it feels like how could we not be concerned that this might happen to us too? And so I really appreciate you sharing that we do have control over these different things and that they really can help reduce our risk and make an impact on us. Um, if you if somebody is watching this and either when you went over those 10 warning signs, if a couple of them were sticking out to them, they were thinking of a loved one, or even if someone who maybe they were recently diagnosed with mild cognitive impairment, um, where would you suggest they start? So if somebody was watching this, they were concerned after you went over those 10 warning signs. I know you mentioned seeing a doctor. Would you suggest they go see their primary care doctor? Would they want to request a specialist? What insight would you have on that?
That's a great question. So, the best doctor that you can go to for a diagnosis, if you haven't already been diagnosed, is a neurologist. Depending on your insurance plan, sometimes you can go directly. Other times you might need a referral from your primary care provider. But I would say that even after visiting your doctor or first receiving a diagnosis, or even as you're feeling concerned listening to the warning signs, pick up the phone and call the helpline. Truly. I'm sharing that helpline number with anyone and everyone. You can call the helpline and ask any question related to the disease. You can call and say, I'm noticing I read the 10 warning signs on a brochure on your website, and I'm noticing some changes in my husband. What should I be looking for? What should I be doing differently? Is it time that we see a doctor? There's no such thing as a silly question when it comes to the helpline. There's not. Navigating this disease is incredibly hard. And so sometimes it does take courage to call the helpline. We don't know what they might say on the other end of the phone, right? It might not be a pleasant answer due to the heaviness of what this disease brings, but it does help to sit and be able to talk to somebody who is kind and compassionate and caring and is accustomed to taking these kinds of phone calls day in and day out. So we do want to encourage that as well.
And thank you for sharing that too, because one of the things that we hear a lot, if we ask, have you tried the helpline? Oh, I don't know if this problem is big enough, or I don't know if it's worth me calling. And we always encourage people, just call. It, like you said, there's really no question that's too small or a request that's too big. That's what the helpline is there for. And so I really appreciate you sharing that as well. Last
Yeah, I
question that
mean,
oh,
last
go ahead.
week, I wanted to add, last week I was over the last few weeks, actually, I've been visiting our support groups. And as I sat through one of our support groups, there was a woman who said to me that she was crying on Thanksgiving. She's caregiving for her mom, and she mentioned that she cried on Thanksgiving because of how hard the caregiving journey was. And my first thought was, I wonder if she knows about the helpline. Even through the holiday season, we don't know how our loved ones are going to react. We don't know if their actions are going to upset us or make us cry, or if their words, if they're not going to recognize us, or if they're going to say something that's you know unkind, maybe not directed to us due to the disease. And so in that moment, I thought, I wish that she knew that we had a helpline that she could have called on Thanksgiving to just have somebody to talk to who would be able to listen to her and help provide some guidance and support for her.
Absolutely. I hope that if anybody takes away one thing from our time together today is the importance of the helpline. And just, I think that's just such a valuable resource that you all provide. And I know it's difficult for you to pick one or two services that you all offer to highlight here, but what would you say are some of the most valuable services that you've noticed that really have an impact specifically on caregivers that the Alzheimer's Association offers?
That's a great question. Our support groups are pretty invaluable. Our support groups meet once a month. Again, we have some in person in Orange County. We also have some via Zoom, but we have an incredible group of volunteers who lead our support groups, who facilitate these conversations. Most of our volunteers have cared for somebody in the past, so they've been through the journey of being a caregiver. They know what it's like themselves. Our education programs are also pretty incredible. For someone who's either recently been diagnosed or who has some memory concerns for their loved one, attending one of our education programs would help you learn more about the disease. We have a program on the 10 warning signs that goes more in depth into each of the 10 warning signs and gives you examples as to, what's normal with the disease and what isn't. What should we be looking for? So those two, I would say, are also incredibly helpful, as well as the helpline.
I completely agree. Absolutely. And so, Michelle, thank you so much for joining us this afternoon and really just sharing such important information about the Alzheimer's Association. I'm very thankful for you and the work that you do and just sharing these resources and what's available and how these programs and services can help both patients and their families. Now, for those of you in the audience that joined us, thank you. And we hope that this information's been useful to you. And we hope that you'll join us again next month for our next live stream event, which is Medicare and Medi-Cal coverage options. And our guest will be from the Council on Aging of Southern California's Health Insurance Counseling and Advocacy Program, also known as HICAP. That's a mouthful. And that will be on Monday, January 27th from 3 to 4 p.m. And so thank you again to you, Michelle. Thank you to all of you who joined us. We want to wish you happy holidays, and we hope that you all take care. And again, just thank you all for being here today.
Thank you, Rachel.